very much, Denise, and we're all really thrilled to be here and wanted to recognize all of the staff and all of the restaurants in Kingston who work so hard to wear the t-shirts proudly and sell the cookies, and as well your volunteers who helped us on kickoff day to raise awareness for University Hospital's Kingston Foundation. And as a group, we're really pleased to present today a check for, maybe Chantal, you can hold it, $67,700.
This number has gone up every single year that we've had this gathering.
Yep.
So congratulations.
You're very welcome.
It's a quick shot. I just want to be able to see everybody, but I just want to say thank you very much on behalf of so many people for your dedication to the work that we do. I want first to say that we don't ever take for granted that you have chosen us to support with your Smile Cookie campaign. We know that there are very many deserving charities out there who could benefit from this type of support that you give. And so the fact that you do that for us really means a lot for us. And I feel very privileged to be able to stand up here and speak, because I'm speaking on behalf of the people who are standing over there to your left. So Kathleen, Mavis, Marsha, Debbie, Trish, they're just a sampling of some of the people who really work the front lines in the NICU, who are the face, who are dealing with it, helping with the families, helping with the babies that are doing that. And so they're the face of who I think of when I see the generosity of what you're doing for us. Whenever we get donations, you always think about, or the thought is often about the money and money buying equipment. And there's no question that equipment is important. So we have a sample of one of our more modern incubators that generosity in programs like this has allowed us to do. We look forward in the future of looking at upgrading our ventilators, being able to look and monitor our babies in a more close and integrated way. And so this obviously allows us to do what we do every day. So I think that that's often the obvious thing. We get money, we can buy the equipment that we need. But I think it's important to realize that there are three other groups, if you will, that you're helping, not just by us having equipment. First, you're obviously helping the babies. And so the babies are allowed to get as best outcome as we can give them. These are babies that are born either very prematurely or very sick because of nothing they've done, but just because of not having a good luck, if you will, and having a lot of difficulty. And I always think about, imagine that if we weren't able to look after those babies here in Kingston. So you think of a family who's been waiting, anticipating the birth of their healthy child, that at some time, either early or at the time, even if they've gone to term, that things have not gone well. Obviously a very traumatic time for them. And just imagine the trauma if they would then have to be shipped off to Toronto or Ottawa, away from their family, away from their supports. And so I think it's, for those parents, I say thank you, because allowing us to do what we do every day allows them to stay together so that they're not separated at this difficult time. And again, I have to acknowledge my team. I know that when I see checks like this, really meaning the support of the community, not just you, but the 67,000 cookies that have been bought. I mean, if you think about that, it's incredible. That lets us know that you're behind what we do. Because sometimes we have some bad days, don't we? And it's sometimes tough to come into work and see some of the distraught families, the very sick babies. And we're often rewarded by seeing the joy of them going home. But in addition, we're rewarded by knowing that our own community, you in particular, who have chosen us to support amongst all the various choices you have there, allows us to get up another day and do what we do. So on behalf of the babies, on behalf of their families, and on behalf of the team that I feel very privileged that I get to stand up here and speak for, but they do all the work. Thank you very much.
They can do, they'll so quickly and easily do it. So thank you for giving them the opportunity to give, because that's really what giving is. I also want to make a point of letting you know that this piece of equipment is not purchased with $1 of government money. If it wasn't for donations like this, we wouldn't have this equipment, we wouldn't have this room. Hospitals are expected to be funded by their communities, and the community has to put up its share for the capital construction, but also more than its share, 100% of the cost of the equipment. And I don't know that the general public generally understands that. And so kind of part of our message is to get that message out, let people know that it requires this personal giving to make these things happen. I was saying to Bob earlier, this has a special meaning for me because I had a child go through this. And she's 37 today. So it's hugely important. It's hugely important, the work that you do, and the comfort that we receive as parents by having this high caliber service in our community. We are really, really fortunate, and the work you do is marvelous. You know, $67,000 is a lot of money. So thank you very, very much.
In closing, I just wanted to make two additional comments. First of all, on Smile Cookie Day, to come back to the office and hear them, everybody's so pumped because they've been out in the community with volunteers from the hospitals and very enthusiastic staff. And it really is a high point for our foundation team to work with all of you and all of your staff each year on this event. So we thank you for creating that opportunity and the opportunity for board members from the hospital and staff from the hospital to get out there and connect. It's really, really meaningful to you. The other thing is that, as you'll know, I had a chance to take a little look at all of the support that we've had from the extended Agnew family, the Tim Hortons stores, J. Agnew, over the last number of years, as recently as this morning. And I know your parents can't be here, but I just am so grateful to your entire family, all of you and your parents, for this incredible legacy of support. And please do convey to them how much we have appreciated that spark they had years ago that encouraged them to get involved in the hospitals, the generous involvement they've had of their time and money and energy and effort and all of it for many, many years. We are so, so grateful to have you in the community and to have you as our partners. Thank you very much.